Hello friends. First of all, let me introduce myself. I am Dr. Birendra Singh Brad. Basically, I am dental surgeon by profession and I am running a Hemophilia society at Guru Gobind Singh Medical College, Faridkot. And I myself is also mild hemophilic and I keep on uploading videos for the education of hemophilic patients, and I upload those videos which I find beneficial and which I apply on myself also. So today we will learn how to do contrast bath therapy in hemophilia. First of all, we should learn what is contrast bath and how it works. Contrast bath means you have to take two mediums of different temperature, means one is on warmer side and one is on cold side. And it works on the principle that when we apply warmth or we apply heat to our body, our veins of the body and veins and arteries, they dilate. So when they dilate, there is more blood flow in that area. And when we apply cold to our body, so the veins of the body contract. So there is vasodilation when we apply heat, and there is vasocontraction when we apply cold. So it works on the principle of warmth and cold. And when we do this alternately, so it produces a pumping effect in that area. With that, the swelling and pain that reduces. So first of all, we should understand what happens when we have bleed in certain area. Suppose I had bleed in my this wrist joint. When there is bleed in this wrist joint, blood flow to the hand, it decreases. So we all know that blood flow supplies nutrition to the tissues of our body. So muscles and tissues of this area, they get weak. You can say there is atrophy of the muscle and muscle wasting of that area when there is bleed in this area, because when there is swelling and bleed, then the blood flow to the hand or blood flow to the distal area, that decreases. So once the acute illness is resolved, you can say when you had bleed in this area, when that acute pain and swelling that is resolved, you can say it can take 3 to 5 days when you give factor support to the hemophilic persons. So in this type of bleeds, we give 40 to 60% factor support. When you get 40 to 60 factor support for 3 to 5 days, then the acute illness that resolves. After that, you should start physiotherapy like this. In this contrast bath therapy, it is also a technique of the physiotherapy, and it should be applied only after the acute illness is resolved. So after 3 to 5 days, when you get factor support, you can start this bath therapy, contrast bath therapy. So now we will learn how to do it. So for doing contrast bath therapy, you need two utensils in which you can dip your hand. One is hot, one is cold. So the hot, that should the hot water, that should be at the temperature of around 40 degree. So I have a thermometer. Let's check the temperature. So this hot temperature, that should be around 40 degree or 40 to 45 degree, you can say. And this cold temperature should be, cold water temperature should be around 8 to 20 degree. It should not be so much chilled, means it should not be on 0 degree or 2 degree. It should be around 8 to 20 degree, above 8 degree. so it can be well tolerated by your hand. So you can see this temperature, let me show you, it is 40 degree. Okay, and let's check the temperature of this cold water. It should be around 10 to 20 degree. Ideally it should be around 15 degree, 12 degree. This much temperature is acceptable. So what we do in contrast path therapy, we dip the affected organ in hot water for 3 minutes, and then we dip the affected organ or your affected limb in cold water for 1 minute. So the ratio should be 3 is to 1 or 4 is to 1. So this can be done up to 4-5 repetitions. Means it will take around 15 to 20 minutes to do the whole procedure. So we should start with the hot water, and we should always end up in the cold water. For hemophilics, it's very important that it should be at the end you should use cold water. You should not end in this hot water. So the temperature of this cold water I am taking, it is around 15 degree. You can see. So when we start, we first start in hot water. We dip the affected hand in hot water for around 3 minutes. 3 to 4 minutes you can dip. So what happens when you dip the hand in hot water? There is vasodilation, so there is more blood flow in that area. And when you dip your hand in cold water, there is vasoconstriction, so there is less blood flow in that area. So vasodilation, then vasoconstriction, it gives a pumping effect in the to that area, and then the pain and the swelling that resolves. And it should be done with factor support. Means you should take around 20% to 40% factor support. You should raise your factor levels, factor 8 or 9. For both type of hemophilia, the criteria is same. Then you should do this therapy. It helps in relieving the pain and the swelling. And one more thing, only this therapy alone, it is not effective. You should do other isometric exercises also. It should be done in addition to your isometric exercises and other procedures. Alone it is not effective. So you should also start your isometric exercises and do this thing. Alternately, you can do that ultrasonic physiotherapy and TENS, that can also be effective, but you should not consider doing it alone. So it's a technique that can be done in addition to the other techniques. So we dip our hand in this hot water for 3 minutes. After 3 minutes, we will dip the hand in cold water. So it is called contrast path therapy or alternate therapy. And you should sit in a comfortable position. So it can be done for the hand, ankle, knee. So if you want to do for the knee, you can pour the water on the knee with a cup, or you can take a shower also, in which you can change the temperature of a water. So for the demonstration purpose, I am taking it in my hand earlier. Ideally, you should take 3 minutes in hot water, then you should take out and dip immediately in this cold water. So hot, cold, then again hot, then again cold, and it should be done for the 3 to 4 repetitions. And you should always end up in cold water. For hemophilic, it is very important to end up in the cold water so that the bleeding should be stopped, or uh, we can you can say end up with the vasoconstricted state, in which there are less chances of bleeding. So I think you understand the technique, and it's Dr. Birendra Brat on Hemophilia Education Group. Thank you. If you have any comments or doubts, you can ask me in the comments. And if you like the video, please subscribe the channel and hit the like button. Thank you.